My name is Charles Jeremy Corbin. I'm a consultant orthopedic surgeon with a subspecialty in upper limb. That means hand and wrist, as well as shoulder and elbow. I work at the Lincoln Hospital. Becoming a doctor was initially a difficult decision in that my parents always expected it, and I didn't particularly want to do anything my parents said. However, I had some good role models in the optician and the dental surgeon that I used to see, and I felt that they gave me the impression of someone who was in control, someone who was helping people, but yet able to control their own hours. Little did I know that was not to be the case on the line. But not only helping people, but also having control of what I wanted to do and what I wanted to provide. That was why I became a doctor in the end. Actually, choosing my specialty was an interesting one. I initially, because of my role models, wanted to be either a dental surgeon or an ophthalmologist. But when I was in Jamaica, I applied for an elective there. I studied in Jamaica. I applied for an elective there, and those chaps were on leave. But I had a very good friend who was in orthopedics who said, well, why don't you come with me? And I found that actually I was more interested and more apt to do orthopedics and the orthopedic injuries, etc. And it just clicked. And from that point on, as a medical student, I was hooked. And I wasn't really interested in anything else as much to that extent. And so after I became a doctor, I did general surgery. That seemed to be more definitive rather than, oh, we could manage it this way or that way and all these different ways. You take this medication. No, I wanted to fix the problem directly. And so orthopedics was the thing that really spoke to me in terms of sorting the problem out. And then, of course, there was the issue with bed stays. And I found that patients with lower limb injuries stayed a bit longer in hospital than I anticipated, or lower limb problems. You did an operation for a problem, they stayed a day or two. But upper limb surgery was essentially what you call either the walking wounded or people with an upper limb problem. They walked into your office, they said, this is my problem. How can you help me? And I would say, yes, we'll do this, but you'll go home the same day. So that was key for me to pick orthopedics and in particular upper limb surgery, because I could sort the patient out, hopefully on the same day. They come in, they go home, they spent it in the comfort of their own home, and they come back to see me with their problems and therefore take up less space in the hospital, and they were more comfortable in their own environment. So that was a win-win for me. Well, the rewarding thing about my job is that a patient comes to me with a problem, find out whether I do the investigations, I chat to the patient, I find out exactly what their issue is as much as I can, and then I can let them know, yes, I can sort the problem for them, or yes, we can work together to solve the problem, or control the issue. And usually, the majority of the times they come to me, I either recommend non-surgical treatment or surgical treatment. They have a day case procedure, and within a few weeks, they're coming back saying, oh, it's fantastic. I didn't have to stay in hospital. You've sorted the problem for me. Thank you very much. And that bit is very rewarding, being able to manage patients almost the majority as a day case, the majority of them almost as a one-stop sometimes. They just come, sort, and go, and then it's just follow-up. So that I find that is rewarding, that they can come to me We work together to solve the problem, and pretty much it's sorted. That is the rewarding bit. So I'm not 100% sure what my patients value about me the most, but what I've been told is that I listen. My patients value the fact that I listened, and I really try to find what the issue is. Even in a busy clinic, we're overrunning, or there's pressure from external agencies, shall we say, to cut the appointments down to the limited amount of time possible. But I listen, and I really try my best to understand exactly what the issue is that's bothering them, and try to solve that issue rather than a prescriptive treatment plan. Oh, you have this problem, this will sort your problem. Actually, no, it should be tailored to that individual patient. And I think that's what patients value about me. Me about them, I value a patient who will give me all the information, that will come to me and say, look, these are the issues, and be truthful. If they don't like something I say, I value that they feel comfortable enough to tell me what their issue is, whether they like me, or what I propose or not. And so we can discuss together rather than feeling a bit apprehensive. So I like that. And that's what I value in my patients, the fact that they are willing to talk with me.